Hi everyone, this is Diane Faligowski with Health Plans in Oregon, your trusted health insurance agent. Yesterday, the new healthcare bill was passed, and I just want to go over some of the important details and how this may affect you or anyone that you may know that's currently enrolled under the Affordable Care Act. Now, I just want to emphasize that there's no changes for 2017. So if you're currently enrolled, receiving tax credits, everything will stay the same. The bill will no longer require people to buy health insurance through the marketplace if you want to use the federal tax credit or subsidy to buy health insurance. It would also eliminate the tax penalty for failing to have health insurance coverage, but insurance carriers can charge over 30% penalty over your premium for 1 year if you have lapse in coverage for 63 days. Tax credits. Nearly 83% or 10.5 million people receive premium tax credits or financial assistance, and the bill would eliminate the income-based tax credits and subsidies available, replacing them with age-based tax credits ranging from $2,000 a year for people in their 20s to maximum of $4,000 a year for those older than 60 years old. Oldest adults under 65 can be charged 5 times more than the youngest. Medicaid. About 73 million people receive coverage through Medicaid. 31 states and the District of Columbia offer expanded Medicaid coverage. Federal funding for the Medicaid expansion phases out by 2020, potentially affecting over 10 million people who are currently enrolled under the expansion. The federal government would give states either a set amount of money for each Medicaid enrollee or let them choose to receive a fixed dollar grant. The Congressional Budget Office estimated in March that the bill would cut Medicaid spending by $880 billion. AARP is concerned the cuts could jeopardize approximately 10 million people who are eligible for Medicare and Medicaid. Pre-existing condition. States can get permission to let insurance carriers charge more for some pre-existing conditions and to exclude some people altogether. States would have access to federal money to help those with expensive policies or conditions. The law provides up to $138 billion for such programs, typically called high-risk pools, but many critics and experts think that this budget won't be enough. State waivers. States could apply for waivers that would allow insurance companies in their states to do 3 things. 1. Charge older people more than 5 times what they charge young people for the same policy. Number 2. Eliminate required coverage called essential health benefits, including maternity care, mental health, and prescription drugs that were required under the Affordable Care Act. Number 3. Charge more or deny coverage to people who have pre-existing conditions such as cancer, diabetes, or arthritis. Taxes. The new healthcare bill, or American Health Care Act, will end ACA taxes on corporations and cuts taxes for the wealthy by about $592 billion. Overall impact. The House approved the bill Thursday without a full Congressional Budget Office analysis of its costs and how many people would be covered. The previous CBO report in March would lead to 24 million people more uninsured after a decade and 14 million people dropping off Medicaid thanks to major cuts and dramatic spikes in premiums for older and low-income people. What happens now that the bill has passed in the House? It moves on to the Senate, where there has been considerably less movement on healthcare. Senators face the same spotlight the House members have for the last 2 months, including enormous pressure from conservative supporters and the White House to pass something, and from the activists, constituents who oppose the bill and want them to scrap it. The margin for error is slimmer than in the House. Republicans have 52 votes and can only lose 2. It's unlikely the House bill would pass the Senate in its current form, and House members voting for the bill fully expect the Senate to make significant changes. That is it, everyone. Thank you for watching. We'll keep you updated. Please follow us on our social media platform, Facebook, Twitter, Instagram, and check our website, healthplansinoregon.com, or feel free to give us a call at 503-998-6169. We'll be happy to answer any questions that you might have. We're here to help you, and we're here to make healthcare easy for you. So if you could please put in your comments, please like our page, or share the video for anyone that might need the information. We appreciate it. Have a wonderful day, and thank you for watching.